Hello, my name is Sheena Delgado, and this is a review of the Neuro Localizer application. The Neuro Localizer app was designed to assist users to identify where a neurological lesion may originate from based on a patient's specific signs and symptoms. It was created by a team of neurologists at the University of Michigan. The intended users are physicians and nurses. The application can be used by nurses as a quick reference guide at the bedside when assessing patients with neurological deficits. The nurse can use the information recorded and apply them to intervention planning and patient advocacy to just reassure that the patient is receiving the correct procedures correlating to their deficits. It can assist with patient education, and it can be used as a study tool for nurses. The very first screen on the application allows the user to enter the location and symptoms of the neurological deficits of the patient by clicking on the gingerbread man. You can click on arms, legs, face, any location, and add up to 5 symptoms. The next screen is the neurological localization screen. This shows the user exactly which part of the nervous system correlates to the deficits entered in the previous screen. By clicking on one of the 4 cylinders, the user will then be transferred over to the next screen, which is the nerve pathways screen. On this specific screen, the user will be able to view exactly which pathways correlate to the signs and symptoms entered in the previous screens. And this is where you would localize your lesion. Some of the benefits to the app are that it's simple to use. If the user clicks on the eye icon at the top left-hand corner, a drop-down appears, and it has some instructions and some information on each one of these sections at the bottom of the app. It's a clean layout. It's free. No personal information is required. It promotes patient safety. It is educational, and there's some humor thrown in for entertainment. Some of the drawbacks are that it's only available for Apple devices. It's not patient-friendly. If you're unfamiliar with medical jargon, it's really hard to use. You won't understand anything. It's limited to certain symptoms. Not all symptoms are present, and you can only pick 5 symptoms. No descriptions or explanations are available on the neurological pathways screen, and it's only available in English. Per the app, the privacy policy states there's no data collected, no location tracking, and they do have a disclaimer that the application is to be used for educational purposes and not clinical decision making. But in conclusion, it's a quick bedside reference for medical professionals. It assists with the process of elimination for ordering procedures. It's a good educational tool for medical students, probably more geared towards residents. But overall, it's a good app to have at the bedside for reference. The last slide is our references, and I hope you enjoyed. Thank you very much for watching.